Okay, welcome everyone to the Aurora Health Alliance Winter Quarterly Community Meeting. My name is Mandy Ashley. I'm the Executive Director of AHA. We know people's Zoom schedules are tight, so we'll get started. Just a reminder that throughout this meeting, if you can please stay on mute unless you're presenting. That would be ideal for us. We also have the ability to mute you if it's becoming distracting. Please take the time and use the chat function to introduce yourselves. You can also use the chat to share programs, resources, and events that your organization would like folks to know about. And you can submit questions for our panelists throughout the chat function. Then after the end, so we'll do the Did You Know panel, then we'll have a brief AHA update. And then if people want to stick around to connect with folks to network, we'll provide breakout groups for that. Definitely no pressure to do that, but we know that that's kind of one thing about AHA that people have really enjoyed, and we're trying to provide that forum for folks. I would be remiss to not thank our affiliates and our sponsors. If you are interested in becoming a sponsor, or if your organization is, drop that. We're trying to plug AHA programming and resources throughout that. So with that, I'll hand it over to Joe, who's managing the Did You Know panel. Thanks.
Thanks, Mandy. Welcome, everyone. And thank you to all our speakers for a Did You Know panel. As you can see, we have 4 speakers today. We have Jessica Giffen of the YMCA of Denver, Meredith Velasquez of Juvenile Assessment Center, Maribel Sandoval from Personal Assistance Services of Colorado, and Melanie Zeitler from the 9 Health Fair. And we're going to start off with Jessica with YMCA.
Hi, everybody. Can you hear me okay? Awesome. This is my first meeting. I'm so happy to be here. I took over for my colleague, Liberty, who was our representative here. She has moved on to attend nursing school. So I'm here and I'm really happy to be here and get to know this group and understand a little bit about how, I can contribute. So happy to represent the Y today. So, going with the Did You Know theme, I thought that was a great prompt. Just wanted to share a little bit about what the Y has been up to this past year, as most of us have had to pivot and start thinking about ways to be creative in reaching our communities. So just wanted to highlight a few things that the Y has been doing. Did you know that we're providing remote learning care for families who needed their kiddos to be doing their remote learning somewhere other than the home? We have been helping to reduce senior isolation in the community. During the shutdown that happened in March, a lot of our Silver Sneakers and older YMCA members were not able to come into our facilities as they used to. And it's a big community hub for a lot of our older community members. So we spent quite a few months doing reach out calls. So our team at the Community Integrated Health Department made over 4,000 wellness calls to our senior members. So it was really, really cool to be able to connect with people and just learn a little bit about them and what they missed about the Y. And we just learned a lot about how they were coping and providing that connection. We also provided free childcare for our essential workers. During the beginning of the pandemic, this was about 170 kids per day. We also have been doing a lot more healthy food distribution, which wasn't traditionally something that the Y always did. So we actually became a hub for healthy food distribution. We distributed over 222,000 pounds of food over the 9 months, serving over 23,000 people in our communities. And then just with virtual programming, a lot of the community programs that we offer are really meant to be in person. So I'll mention a little bit more about these programs, but a lot of them are chronic disease prevention programs, and it's really hard to kind of shift gears and deliver these virtually. So we had to help orient all of our people to use Zoom. I know we're all like Zoom bosses at this point, but in the beginning, Zoom was not a really common way to connect. So just kind of relaunching and reimagining how to reach people has been something that's been really, really fascinating to see how people can really be flexible. And then just over 6,000 community members have been taking our fitness classes virtually. So from the comfort of their own homes, we have silver sneakers classes, classes geared towards seniors, classes geared towards all fitness levels. And we've shifted gears so that they're being offered virtually. Next slide, please. And just wanted to do a deeper dive. I'm part of our community integrated health team, and these are just some of the programs that the Y provides to the community. The first is our blood pressure self-monitoring program. We are offering this program at no cost. This is basically a 4-month program focused on helping people become aware of high blood pressure, hypertension. We have Healthy Heart ambassadors who help people who are participating in this program learn how to take their blood pressure and really take a proactive approach in monitoring that. Live Strong is a program that we offer for cancer survivors. This is a 4-month program offered through the Y. It's currently on pause. We haven't been able to shift that one into a virtual offering quite yet, but we're hopeful that we can get this one back up and running. We offer a weight loss program, which we'll be gearing up to offer again. We have a nutrition team that offers consultations, nutrition education. We also offer Healthy Weight and Your Child for the community. And then of course our flagship program, the Diabetes Prevention Program. This we've been offering since 2012. We help anyone who is at risk for type 2 diabetes manage their health through learning how to eat healthy, learning how to be physically active, even when they feel like there's no time in the day. And this program has been proven to reduce the risk by 58%. So it's a really awesome program. And we have been delivering this one virtually. And it's been a really, I don't want to say seamless, but we've been able to kind of transition this one to virtual, and we have new classes coming up starting as early as next week. So really excited about that. Happy to be here again. The Y offers financial support for all of these programs for healthy living. And I believe that's all I have today. So thank you. The last slide is just my contact information and our general inquiry email if you're interested, or if you have people that could use our programs. Thank you very much.
Awesome. Thank you, Jessica. Appreciate it. All right.
There's one question that came my way. Let's see, I'm like multitasking. Where did it go in the chat? It seems that there's a huge focus on the senior population, and is there any support that the Y offers for technology and helping some of those seniors get adapted to Zoom land?
That's such a great question, and that's one that came up actually last week. In the past, we have offered technology classes to seniors. That has been on pause, and we haven't offered that recently, but it's something that we are thinking about. We have informally been coaching all of our seniors that have joined our programs into learning how to do Zoom, but it's not something that's kind of a universal offering at this point. It's really just on a case by case basis. Mm-hmm. But it's such a great question, and it's something that we've heard in the last week also. So it's something that we're examining.
That's interesting. Yeah. We've also had the concern about people in the 70 plus age range having to schedule their vaccines electronically. So it all ties in. So it's great to hear that the
Yes.
Y is focusing on helping folks out with that way. I think that's all that was in the chat.
Awesome. All right, so we'll go on to our next speaker. Go, Meredith with the Juvenile Assessment Center.
Hi, everyone. Thank you so much for having me. This is not my first AHA meeting, but I am fairly new. Our previous director used to come to these, and when she moved on, I started coming about a year ago. It feels new because the last year feels like, I don't know what, but it feels kind of new. So here I am. My name is Meredith Velasquez. I am the Community Assessment Program Director with the Juvenile Assessment Center. I apologize, these slides are, I've never talked about the JAC in 3 slides. So I'm gonna do my best to just get through the, the surface of everything and then take any questions, and obviously feel free to contact me. So the Juvenile Assessment Center, a lot of people have heard about it and know certain things. We are basically an assessment and referral center. We provide free biopsychosocial assessments to youth and families, and then connect them with resources in the community. I think one of the biggest things that people don't know about us is that we have 2 programs. So while a lot of people hear about us because we process and screen all kids that are arrested in our 4 counties, which is we'll see Arapahoe, Douglas, Lincoln, and Elbert. We also have a community assessment program, and I'll go through both of those so you guys know more about each one and the differences in those. Originally, the JAC, which people also call us the JAC, was created as a single entry site for youth that were picked up by law enforcement because they were showing up to court and nobody had any idea who these kids were, what was going on in their life, and they were just, kind of dealt with in that manner, which is not helpful. So they were just addressing behaviors of kids and not the circumstances of their life. Originally, the JAC was only accessible by law enforcement. So I think about, 17 years ago is when they first started taking kids, and they were on a pager system, and every time a kid was arrested, someone would be paged to the jail to talk to the kid. Obviously, we have grown a lot since then and have different sides of everything here. Every judicial district has a JAC, so we're all spread out and split up. But our JAC is a little bit different because we're one of the only ones in the state that is a nonprofit, and we probably have the most accessible community prevention program out of all of the JACs. Most JACs focus just on that law enforcement piece, but we've really grown from that side. But on either side, our main goal is to give that comprehensive assessment and then provide case management to the families for as long as they need us, and to get them connected with some type of resource. And last year we served over 2,500 youth and families in Arapahoe, Douglas, Lincoln, and Elbert counties. Okay, next slide. So the first program I'll talk about is our original program, the law enforcement program. It is located in the Foote Detention Center. We do have an office space there. And then we do have an office space here where I am at the Family Resource Pavilion. We have a couple suites in this building. I don't know if you guys know a lot about the Family Resource Pavilion. If you have questions, I can answer them, but for the sake of time about the JAC, I'll move on quickly. That program is only accessible by law enforcement. So any kid that is arrested or picked up is screened through that side prior to going to detention if they're eligible. We also do assist with runaways, dependency and neglect cases, kids that are involved with the Department of Human Services, all municipal level cases. So not every kid that gets arrested goes to detention, and there's a screening process behind that. It is a 24/7 operation. I will say right now, they are set to come back February 1st. We are only screening kids that are going to detention. So we haven't taken runaways since in a couple months. The pandemic has kind of had them on and off for a little bit. But as of February 1st, we will be back. They will be back in the office. So the kids that are served on that side must be between the ages of 10 and 17. 10 is the youngest age you can be arrested in our state, and 17 is the oldest, and then 18 you're an adult. They do give an assessment on that side. And then they send a report and the resources to the court so that the judge knows and the professionals involved know what's going on with this kid, rather than what he's just being charged with. And then they also do follow up on that side as well. Next slide, please. The program that I am the director of is a community assessment program. It was created about 10 years ago, and really kind of grew as we became a nonprofit, and has grown tremendously the past few years when we moved into this Family Resource Pavilion. We do have locations for our CAP team in the MLK Library, in the APS Welcome Center, the Family Resource Pavilion, and in an office in the Douglas County Human Services building as well. So basically what we do is take referrals from any community entity or professional, and provide an assessment for that family, and then case management to connect them to resources. The assessment process itself, it does take about 2 to 4 hours. It's a biopsychosocial, so we are really asking families to kind of, give us everything they've got the first time we meet them, which we have found works out pretty well for us. It's kind of nice, just to get to know everything that's going on. Most of the reasons that families are referred have to do with truancy, mental health issues, substance use, depression and anxiety, I would say are probably our top reported issues amongst youth. But really most of those referrals come from the school. They come from the Department of Human Services. They come from law enforcement. Parents just call us. They randomly get our number from the crisis line, brochure, and they say, I need help with my kid. They're using drugs, they're skipping school. Really any crisis that they have is our crisis. So we also serve Arapahoe, Douglas, Lincoln, and Elbert counties, but we do not turn away families because of where they live. We often serve families in Denver and Adams County as well. After the assessment process, we will talk with the family about what's going on, what we think they need to do next, what are the next steps, and then provide as many direct referrals to services as possible. Typically, we are looking at behavioral health and mental health services, in-home providers, substance use programmings that could be intensive outpatient or just outpatient. We do help families with basic needs, any educational supports or alternatives, mentoring, pro-social activities. And then a lot of our families are also system involved. We do see kiddos that have already hit some level of care or some system, and we do help them with that navigation as well. We are seeing families in person right now. There was a short time where we did not, from March till June probably, when we didn't know anything that was happening. Not that we still do, but we have a little bit more handle on what to do. But our community assessment site is offering in-person assessments for families. We have been since June, so that's been nice. And then our engagement rate, which is something we're pretty proud of, is 82%. That doesn't mean the family went and did everything we said they should do or everything we thought would be helpful. But they did engage in something, and we are still working with those families. So that's kind of nice to know that we're still involved in their life in whatever way they want us there. All they have to do is reach out or answer our email or phone call. We do work with any school-aged kiddo on this side. So that's one of the other differences between our programs. The youngest I think we've served is 5, and the oldest is probably 19. And I think that's it. I think I got most of it on this page. There was a lot on that slide, but next slide, I believe, is just my contact information. I know there's so many things that I did not cover, but that's kind of the gist of what the JAC does and who we are. I am open to anyone contacting me about questions because people always have a lot of questions about either program, but that's okay. So if you have anything that you think of, just let me know.
I had one question come in. Well, actually 2 questions. How are things, and you touched on this a little bit, how are things different with COVID, and what's the plan to get more back to normal after vaccines are more widespread?
Yeah, so like I said, our law enforcement program will be coming back to the office on February 1st. And then at that time, we will see kids in person. Right now, they're just doing all that screening over the phone. So things should be mostly back to normal for them in February. We were all home March till June. We all came back in June in like a phased, re-entry. And since that time, the CAP side really hasn't changed. I will say we do offer teleassessments, and a lot more families are scheduling those. We're totally comfortable with that. We really like in person, but obviously we have people here that are immunocompromised, and we're worried about their safety as well. So people will be working in and out of the office. I'm sure as many agencies have found it works for us. I think the most impact that it's had is, the families and the kiddos that are really falling behind in school, that really need that in-person just interaction, whether it's socially, recreationally, whether they need tutoring. It's just been really difficult. So I'm hoping that as things get more back to normal, that we're able to provide more resources. Because right now, when a family comes in and we do an assessment, we're connecting them with resources, but quite honestly, most of them are virtual at this point. I mean, there's very few agencies that are still going into the home to provide services. And that has impacted us a lot. But as far as referrals and things like that, once we came back to the office and school started back up, it felt like we were getting the same amount, a little bit slower, but we're still happy to be here and happy to be serving a lot of kids. Our agency was approved for the vaccine, since we have been seeing families in person. So we are very lucky that most people have already gotten their first vaccine, and as soon as everyone has their second, for us, it'll be business as usual. Not that we won't be concerned or taking any precautions, but we're feeling a lot better about that as well.
I'm sure that'll be a huge relief. And then
Yeah.
this is just a question for me.
Uh-huh.
For the Aurora Health Alliance is involved with the State Health Information Exchange planning. And one question that and I can talk offline, we'll highlight it in our newsletter for those who are like, what is that? But I was curious, once a referral is made, or a resource shared, how is that tracked, and are there challenges with the tracking of that? Because I assume you guys you have a big volume.
So you mean like internally for us? Okay, so
yeah, or is it on the agency that you refer to? Who handles?
Yeah, we keep track of all of our own referrals. We have logs that we use, and we also use a system called Civicor, a client management system called Civicor, which allows us to pull data in any kind of way, really. So, we can pull really whatever we want, and we track a lot of data every month because a lot of our programs are grant funded, or, we have to report out on that kind of stuff. So, I mean, if there's anything specific you want to know, I can pull it and yank it. There are some things that we do every month, and we separate it by each program and where the referral came from. And then when we do track what we call engagement and follow-up, obviously we're reaching out to the families. Our Civicor system tracks that as well, and we can pull that in data also. And then it creates a rate of engagement for us. Just depending on what came out of the case management plan.
Cool, thank you.
Yeah.
That was definitely a selfish, for the greater good of the community question. I'll be connecting with you offline.
Yeah.
Then just take a peek at the chat. There's someone singing the Jack's praises. So.
Oh, thank you.
Yeah.
Cool.
Awesome.
Thanks, everyone. Feel free to email me or call me if you have any questions.
Thanks, Meredith. Thank you very much. And just a reminder for all of our Did You Know speakers, if you want to just make sure you throw your name and contact information in the chat too, if you haven't done so already. And we will also be sharing the slides, if the speakers are willing, in our follow-up email too. So we'll keep sharing all this information out to you. All right, so next up on our Did You Know panel is Maribel Sandoval, who is with Personal Assistance Services of Colorado and also an Aurora Health Alliance board member. So Maribel, I will let you take it from here.
Thank you, Joe. Hi, everyone. We're so glad you can join us today. As Joe said, my name is Maribel Sandoval. I am the Bilingual Community Outreach Coordinator here at Pasco. And I also have the privilege to serve on the Aurora Health Alliance board. Did you know Pasco has proudly served the Colorado community for almost 30 years as both an advocate and family caregiver agency? In 2001, Pasco advocated alongside Colorado families and lawmakers to establish a program that allows family members to be paid to deliver care to their loved ones. Next slide, please. Did you know in Colorado, individuals living with physical and/or intellectual and developmental disabilities can access long-term services and supports through Health First Colorado or Colorado Medicaid's program? Did you know Colorado has 10 different waivers? Pasco has expertise and works with 8 out of the 10 waivers. What is a waiver, you may ask? A waiver is an extra set of Health First Colorado benefits that you could access to qualify so that someone can qualify in certain cases. These benefits can help you remain in your home and community. Did you know that there are 4 different ways to access the Family Caregiver Program that serves individuals of all ages, from childhood to adulthood, which increase long-term community engagement and independence? I'll go through the 4 programs briefly, and you can see them on the screen. The first one is the family member as a CNA. A family member can become a CNA, certified nurse's aide, caregiver, and support their loved ones as a Pasco employee. Pasco pays for the family member, a friend, a neighbor, or any caregiver of choice to go to CNA school. This is offered through Health First Colorado or Colorado Medicaid. The second program is IHSS, or In-Home Support Services. Family caregivers can bypass CNA school through a Pasco nurse's skill validation and provide qualifying services at CNA level and above. This is a great option for those that qualify because they can start getting paid once they are a Pasco employee for care they are already providing in many cases. IHSS, or In-Home Support Services, is available through the following waivers. For children, it's the home and community-based services, and for adults, it's the elderly, blind, and disabled, or also known as EBD, and spinal cord injury, or SCI. And please feel free to ask any questions in the chat, and I will answer them after this. The third program is Pediatric Personal Care. This program gives the parent a break and pays someone they trust, a family or relative, to provide care at Pasco as a Pasco employee. This is the only program where it cannot be the parent or legal guardian providing the care. However, it can be a grandmother, an uncle, a sibling over the age of 18, or a neighbor. This program helps many kiddos under the age of 21 that experience autism, Down syndrome, or behavioral challenges that need help keeping on task. The fourth program is the Intellectual and Developmental Disabilities. As a direct service provider, also known as DSP, a family member works with their loved ones to develop greater long-term independence. Pasco is a PASA, which it stands for Program Approved Service Agency. Individuals can remain in their homes with services and supports that allow for community integration. IDD is available through the following waivers. CES, which is Children's Extensive Supports, and for adults is the SLS, Supported Living Services, and DD, Developmental Disabilities. One of the things that we are very proud of Pasco is to have an internal client services manager who is helping parents one-on-one navigate the world of Medicaid to select the best option for their loved ones based on their unique circumstances. This is a lot of information, so please know our experienced and friendly intake team and nurses can help navigate the complex options and determine the fit for individuals for your individual situation. Next slide, please. Did you know Pasco offers full-time benefits to employees that work 28 hours or more a week, including paid training, health and dental and insurance, paid sick and vacation time, paid overtime, holiday pay, and no cost 50,000 life insurance. They receive weekly paychecks and they have 24/7 access to nursing supports and agency supports. We recognize that caring for a loved one is a 24/7 commitment. Next slide, please. We are proud to provide services and supports in 15 different counties across the Front Range. Pasco nurses are available for assistance and supports to ensure your loved ones can care plan is focused on their long-term goals. And Pasco staff coordinates with case managers and physicians in supports of client and employees. Next slide, please. To sum up, Pasco serves individuals of all ages. Family caregivers can be paid as a Pasco employee to care for a loved one living with a disability under Health First Colorado. And we would love to hear from you and your loved ones. I will share my contact information in the chat. We also have an intake bilingual coordinator, and they will guide families through the process. Thank you.
Thanks, Maribel. Same question keeps coming in. How has COVID impacted your operations, your flow? What's an update from the Pasco?
Yes, I think that our families are very fortunate to be in this model where they are at home with their loved ones, taking care of them and being paid as a Pasco employee. So in that matter, I think that they are very fortunate. I think we are seeing this more and more, people seeking out options where they can take care of their loved ones instead of being in a different setting where they're more exposed to the virus. But yeah, I think that it's a really good option to have for many caregivers that want to take care of their loved ones in their home.
Thanks. And just a request for an email and your email to be dropped in the chat. And then how do most families get connected with Pasco? What does that do? How do they hear about you? How do you find them? That kind of thing.
So it's really easy. They can go to pascohh.com and there's a contact us. So anyone can send us a referral for their loved ones. They can also call this and a live person is answering the phone, guiding them to the right department. And I will also share my contact info so they can call me directly and I will be sure to connect them to the right person. So I will drop all that here in the chat momentarily.
Cool. Thanks.
Thank you.
Awesome. Thanks, Maribel. Really appreciate it. We are on to our fourth speaker, Melanie Zeitler with the 9 Health Fair. Melanie, are you there?
I'm unmuting myself. I do that at least once a day.
We all do it. It's okay.
I'm so sorry about that. I just wanted to first, quickly thank Mandy and Joe for inviting 9 Health to come and speak today and the Aurora Health Alliance. This is my first interaction with all of you, so thank you so much for that. We have 3 slides. I'm going to kind of walk through them quickly. And of course, then you'll have them at the end to, read more thoroughly. But did you know that 9 Health started more than 42 years ago? It was born out of 9 News. but it's its own 501c3 nonprofit organization, and it holds really an irreplaceable trust as its brand. And that's mostly thanks to 17,000 volunteers annually who serve underserved communities statewide. In reality, this tremendous asset was really built on volunteerism, and on the ground in underserved communities, accessible to all. Volunteers have run, 9 health fairs for over 42 years. So we are so grateful. Annually, about 55,000 people attend health fairs, anywhere between 45 and 55,000. And in order to keep the costs low for the health screenings and services, it really is about scale. And so scale and volunteers. We know that 60% of health fair attendees end up visiting a healthcare provider. And we know this because we have a partnership with Civic, and they are able to overlap some data for us. And they were able to determine that 60% of health fair attendees did indeed visit a provider after getting a screening. 5% of people attending 9 health fairs are often called with urgent or out of range results that need immediate follow-up. So these people are in some pretty serious need of follow-up care. So we help guide them. And that's all done within 24 to 48 hours of receiving their screening results. The work of the organization, believe it or not, it's a kind of a shocking number, but we solicited an agency called QRM, which is a research firm here in Denver. And they determined through a lot of data that 9 Health has saved the state of Colorado and its residents over $1.9 billion per year. So really staggering number, kind of hard to believe and wrap your brain around, but the data is there to support that. Today, we've added online screenings, mostly mental health screenings, so anxiety and depression screens. We also have added Quest Patient Service Center screenings because we haven't been able to do in-person health fairs in any large volume since the pandemic hit. We also have CirrusMD as a telehealth partner. It's a local telehealth startup. And 9 News is still behind us on air with education and helping to facilitate that preventive health education, especially through Dr. Coley, Pyle Coley. I don't know if any of you have seen her on TV, but she's, given a lot of updates on the coronavirus and other preventative health education news that's timely. And we have a plan to keep moving forward. So these past few years, 9 Health has self-invested in its infrastructure, building access to its data warehouse so that we have the now potential of predicting chronic disease of health fair goers through trending data over 5 years. So some really good insights for people. And then basically for half the cost of one urgent care visit, 9 Health is able to, through this package of services that I'll describe to you a little bit more in the next slide, can do this for less than $100 per year per person. So if we can go to the next slide. Thanks, Joe. So answering the current pandemic, 9 Health established COVID-19 partners, and the governor's office actually asked 9 Health to get involved with the vaccination dissemination. So we are working with CDPHE, COVID Check Colorado, and Safeway Albertsons Pharmacies and others to come to capture this health moment, really. And part of the strategy is to, while we're delivering the vaccination fairs in partnership with others, is to convey evidence-based preventive health education during that moment where, people for 15 minutes or, 30 minutes have to be watched after getting their vaccination, we have this moment to sort of really stress the importance of preventive health. So basically, we want to be able to turn screenings into actionable information and motivation, and giving people sort of the indications of what to do next and giving them preventive health medical guidance. We started a program called 9 Health Neighbors that is a consortium of about 100 plus medical volunteers who within 24 hours will answer someone's call that has a health question. A lot of them have obviously been coming in around COVID, but other things too. And then we're able to give referrals at that point to, particularly federally qualified health centers and other referrals for people who don't know where to go or how to get, medical help or attention that they need. 9 Health also has a video library of health information. So we have done, over 250 Facebook Live episodes, many with local health experts, including Dr. Payal Kohli from 9 News, everything around COVID to other preventive health, evidence-based health education. So people can access that for free on our website. And basically, we really imagine getting this package of our services into the hands of people who really can use it, need it, and doing it through 2 channels, direct to consumer. So 9 Health is available to the public, and there's a new audience waking up every day to the value of prevention. And they just don't have maybe the mental space or time to go searching for it. So we can help them with that, making it easier to access through our package services. And then also through population health, we're finding a lot of interest in the value of prevention and access to care by populations, especially those impacted negatively by insurance or demography or geographic challenges. Underserved communities, African American, Latinx, and recently unemployed during, the pandemic. And we're also working with older adults with the Area Agency on Aging and the State Unit on Aging. Can we go to the last slide, Joe? Thank you so much. So basically, did you know there are lots of ways to, get connected with 9 Health and even help 9 Health? We're really looking for volunteerism, especially now that we're getting into vaccination fairs. We're going to need a lot more volunteers around that. And donations, of course, are always welcome. And then just to engage folks in prevention. It's, we would really love partners in this work. And that's why it was so important for us to come and talk to the Aurora Health Alliance, because there's so many awesome organizations doing great work that we could partner with and leverage, to the benefit of the community and prevention. And so basically, thank you for letting me share a little bit about 9 Health and what we're doing in the community. And if you have any questions, feel free to put them in the chat, or I think I sent my email to everyone in the chat. And then at the bottom of this last slide, Gary, our CEO, his contact info is there as well.
Thanks, Melanie. There's a couple questions that came in through the chat. One just wanting a little bit more information about how to talk to underserved communities about the COVID vaccines. I assume it's also the COVID-19 vaccine.
Right. That's exactly right. And I really appreciate that question. We are working with a company called Access Mobile and also COVID Check Colorado, which I think many of you are familiar with COVID Check. They are helping us to really micro-target those communities that are underserved. And so we're able to get into those communities through this micro marketing targeting, if you will, speaking the language of health to those communities in their communities, and letting them know about these vaccination fairs. We start 3 pilot sites in 2 weeks with CDPHE and Safeway Albertsons, and we do have the 3 sites that we're beginning with identified. We're just not allowed to publicly say yet. So we will kind of keep people posted.
Thanks, and wish you the best of luck on that
Thank you.
new chapter of
Yes.
this pandemic. And then one other question, after online screenings, who do the folks talk to at 9 Health Fair, and who do you refer to?
Yeah. So we have, again, that 9 Health Neighbors program with 100+ medical volunteers, and then people are able to call in and ask specific questions, and they get, obviously professional guidance from a physician or other healthcare provider that can give them next steps. Or we have what we call our own blue book. So it's essentially a resource guide of, if somebody has problem X, who can we connect them up with in the community. And that's why speaking to groups like, AHA is so important, because we're able to kind of, add resources to our, folks to be able to share with the community. So, would love to have input on, intersections where other organizations, like your own, feel like, we could help direct people to the right resources at the right time.
Just wrote a note to be following up with you offline about highlighting some of the stuff you're doing in our newsletter. So.
Excellent. Thank you so much. And thank you, everybody, for your time.
Thanks.
Awesome. And thank you to all of our Did You Know panelists. Thanks for sharing the great work that you do in the community.
Thank you.
Okay. Take a deep breath. Happy Inauguration Day. It's also a palindrome number for those who that's attractive to. It's attractive to me. It's 12021, today's date. So I'm going to go through a couple of slides, just updating you on what the Aurora Health Alliance is up to. So I don't know if you have seen, we have a YouTube channel. I'm going to drop it in there we go, in the chat right now. We have been focusing on the COVID-19 vaccine distribution and getting the word out about that. Dr. Anuj Mehta was interviewed for our first YouTube video, and since then he's presenting everywhere, and we're so grateful for his time in informing us about how the vaccine distribution planning took place. So right now we're focused on our second video, and we want to help tell the story of Aurora during this vaccination. So reaching out to organizations whose workforce is being vaccinated now, and help asking them to connect us to people at all levels. It could be, a doctor, it could be housekeeping, it could be anywhere in between. And we want to know why people are getting the vaccine and what they do and how they fit into the Aurora community. So if you have anyone that you're working with that we could highlight in that video, you can email that. I'm just multitasking. info@aurorahealthalliance.org, and we will connect with you about that. So, secondly, I wanted to highlight Tri-County Health Department and their COVID-19 website. We love Tri-County Health Department. They have accurate and up-to-date information about the COVID-19 vaccine. So wanted to highlight that in case you're not aware. I'm sure most of you are, but just in case. That's the COVID update. I think next we'll talk about interest groups of AHA. So I just wanted to highlight our February interest groups that are coming up. The kids group will be on February 2nd. All of our calendar things are at the link that I just sent in our calendar. You can register for any of these groups. So at the kids group on February 2nd, we'll be hearing from Stride and the Families Forward Resource Center. On Thursday, February 4th, we'll be convening our Access to Specialty Care interest group, and we're mostly going to be at that meeting planning the work for the upcoming year. We know that telehealth is big, but also the pandemic kind of threw a wrench in what that group was doing. So come and give your feedback and help us plan what the activities of that group will be. Finally, our second behavioral health meeting ever will be on Wednesday, February 10th. We're going to be hearing from Summer with the Colorado Department of Human Services. So that should be good and interesting. I think. There we go. Then our last update, I just wanted to let you guys know that our next quarterly community meeting is going to be in April. So I'll drop the links for all of these when I'm done talking, so you can have them in the chat. Just really encouraging people to keep the momentum of AHA going this year. We know it's hard. If you have any input on how we can improve our meetings or engage with you, please let us know. There's not any plans until the pandemic is under control to convene in person. That's for sure. Thank you all.